I'm Nurse Practitioner Kelly with Daily Elite Health and Wellness, and welcome to our Root Theory podcast. Now, today I want to have a very important conversation about GLP-1 medications, about weight loss, metabolic health, and what healthy and sustainable weight loss should actually look like. Now, GLP-1 medications like semaglutide, that also goes by Wegovy and Ozempic, and dual incretin medications like tirzepatide, also known as Mounjaro and Zepbound, are everywhere right now. Patients are seeing them, I'm seeing them, and the advertisements are all over social media. They promise rapid weight loss with very little discussion about nutrition, muscle preservation, metabolic health, lifestyle change, or long-term sustainability. Now, I want to be very clear at the beginning of this conversation. GLP-1 medications are not inherently bad medications. In the right hands and with the right patient, with proper screening, monitoring, education, dosing, and follow-up, they can be extremely helpful tools. I prescribe them in my clinic. Now, I have patients in my medically managed weight loss program who are not on medication, and I do have patients who are on them. I have seen them improve blood sugar regulation, reduce food noise, improve insulin resistance, and help patients begin making meaningful metabolic changes. So that's the goal, metabolic health and metabolic changes. Now, my concern is not the medications themselves. My concern is when these medications are prescribed as a one-size-fits-all weight loss product with minimal medical oversight, minimal education, little nutritional assessment, and long-term planning. I regularly see patients who come to my clinic after participating in programs where they received a prescription, paid a monthly fee. In some stories I'm hearing from patients, they had to pay an entire yearly fee, all 12 months up front. And I'm wondering, how do we even know that the patient needs to be on a medication for a year? That's very concerning to me. Now, these patients have lost weight very rapidly and then develop fatigue, weakness, muscle loss, worsening nutritional deficiencies, constipation and diarrhea, dizziness, hair loss, low energy, poor exercise tolerance, and significant rebound weight gain after stopping the medication. Weight loss alone is not the same thing as metabolic healing. Again, metabolic healing is the goal here with the GLP-1s. The weight loss is an awesome side effect when done properly, but the goal is metabolic healing. And rapid weight loss is not automatically healthy weight loss. In fact, it is quite the opposite. Now, one of the biggest misconceptions in the public right now is that obesity simply means someone is overeating. Clinically, many patients with obesity or metabolic dysfunction are actually metabolically undernourished or nutritionally malnourished despite excess caloric intake. Now, they may consume enough calories, or in some cases even excessive calories, while still lacking adequate protein, micronutrients, fiber, minerals, and metabolic support nutrients necessary for healthy cellular functioning. Now, in my clinical experience, many patients presenting with obesity or metabolic dysfunction also demonstrate evidence of nutrient insufficiency, insulin resistance, inflammatory burden, hormonal dysregulation, poor sleep physiology, gut dysfunction, reduced stress resilience, and impaired metabolic flexibility. Many patients have low or suboptimal levels of nutrients involved in mitochondrial energy production, glucose metabolism, muscle function, neurotransmitter production, oxygen delivery, antioxidant production, and metabolic regulation. That may include magnesium, B vitamins, iron regulation issues, vitamin D, vitamin C, trace minerals, and other nutritional depletion patterns depending on the individual patient. Now, that does not mean nutrient deficiency is the sole cause of obesity. Obesity is very complex and multifactorial. Genetics, hormones, insulin resistance, sleep disruption, stress physiology, medications, physical inactivity, ultra-processed foods, added sugars, emotional eating patterns, environmental factors, and many, many other variables all contribute. But nutritionally, status absolutely matters. So if you are nutritionally deficient, if you are in nutritional apocalypse, you're going to put weight on and or not be able to take it off, right? So when a patient comes to us with GLP-1 medications that they're already on, or they're wanting to start GLP medications with us, and they do not have adequate nutritional support, especially if they are eating very little, losing weight very rapidly, under consuming protein, and not preserving muscle mass, they may worsen underlying deficiencies and metabolic dysfunction over time. And this is where I strongly disagree with some of the marketing currently being used in the weight loss industry. I have seen advertisements implying patients can lose weight without exercise. I've seen that billboard. I've seen that billboard saying they don't have to change their diet. They don't have to change what they're eating. They don't have to change any of their lifestyle habits at all, and they don't have to make any long-term lifestyle changes. I believe that messaging is misleading and potentially harmful because sustainable metabolic health almost always requires a broader lifestyle support alongside the medication. The medication may suppress appetite, but it does not automatically teach patients how to nourish themselves, how to preserve muscle mass, improve their sleep, regulate their stress eating, improve metabolic flexibility, or maintain long-term healthy behaviors. So one of the ways I explain this to my patients in simplified terms is this. If the body experiences prolonged periods of very low intake, inadequate protein, nutrient depletion, and rapid weight loss, the body can undergo adaptive metabolic changes. To your body, it's kind of like you're in a famine. There's a drought. There's no food to be had. Nutrition's not coming in. Oh my God, we are in starvation mode here. So your resting energy expenditure may decrease. Lean muscle mass may decline. Hunger signaling may increase. Feeling full may decrease. And the biologic drive to regain weight may become stronger more than ever after stopping the medication, especially if the underlying metabolic and behavioral drivers were never addressed. Underneath the treatment for the GLP-1s, you have to have metabolic healing. That is the overarching goal, metabolic healing. That is why many patients regain weight after discontinuation if there was never a comprehensive metabolic and lifestyle plan in place. Again, this is not because the medication is bad. It is because the medication is a tool, not a complete metabolic rehabilitation program. And this is why we created our medically managed weight loss program at Daily Elite Health and Wellness. There is a major difference between medically assisted weight loss and medically managed weight loss. Very big difference. Please pay attention. Medically assisted weight loss often centers around gaining access to medication prescription. Not all the clinics, not all the programs have structured their program around taking money from people just so that they have the right to be prescribed these medications. I get patients coming into this clinic who have had this experience. They have minimal interview with a provider, oftentimes online. In some cases, patients are reporting that they have 3 to 5 minute interviews where very minimal questions are being asked about their health status. And I do see this, and I have talked with other providers in the industry that have a policy where they're going to guarantee everyone a GLP-1. Not all places do this. Some places do. I just want to get the message out there so people can avoid these places, right? So being considered for GLP-1 medication is very critical that the provider understand the nutritional deficiencies, the metabolic dysfunction, the iron dysregulation, lifestyle habits. We need to know all of that so that we can prescribe these medications safely. Not every patient is a candidate for these medications. A lot are, but some are not. And we need to be able to understand and recognize that and then come up with other plans for these weight loss programs that can incorporate seeing patients, help them become healthy, and maybe not use a GLP-1, maybe use a different medication, or maybe, like I sometimes do, I have patients that are not on medications at all. So medically managed weight loss focuses on the whole patient. So we evaluate metabolism, nutrition status, body composition, meaning what is located where is the muscle mass, where is the fat lying. We want to know exactly where everything is located at. We want to know about insulin dynamics, lifestyle factors, exercise patterns, stress physiology, sleep quality, hormonal patterns, any inflammation you may have in your body that is preventing you from losing weight, digestive functioning, and how well you are absorbing the nutrients that you eat. We look at long-term sustainability, not just short-term gains, but long-term, lifelong sustainability. When patients start our program, we see them every 2 weeks for the first 2 months because that is when the greatest physiologic adaptation is occurring. These visits are not simply weight checks. We monitor body composition, body measurements. We measure the body with our tape measure. We check on symptoms, energy, hydration status, bowel function, because often on these medications you can get delayed bowel functioning, you can get diarrhea, you can get constipation. Some people can get bowel blockage. We have to monitor for that. We monitor for protein intake, exercise tolerance, recovery, and overall metabolic response. Now, our goal is not simply to make the number on the scale smaller. That's an added benefit. That's a great side effect from the medication. But our goal is healthy body composition change, reducing excess adiposity, that means fat, while preserving lean muscle mass. Now, we want to preserve strength. In fact, we want to increase your strength. We want to increase your metabolic functioning, and we want to optimize your nutritional health. Now, patients also receive detailed education and structured treatment planning at every single visit. Each session builds on the previous one. We provide comprehensive educational handouts covering nutrition, protein intake, fiber intake, exercise resistance training, stress resilience, metabolic health, sleep optimization, behavior changes, and sustainable lifestyle strategies. We want patients to become educated participants and partners in their own health care. The goal is for patients to eventually understand their own physiology, metabolism, nutritional needs, and long-term health patterns well enough to make informed decisions for life, not just while taking medications. We are trying to create metabolic independence and healing, not medication dependence. So I'm going to say that again. We are trying to create metabolic independence, not medication dependence. Another important distinction is transparency. Our subscription model structure is built around medical oversight, education, monitoring, very close follow-up, and comprehensive support, including labs. Medication pricing is very transparent. In fact, we show you the exact price from the compounding pharmacies that we pay to obtain the medications, and that is the price that we charge you. We do not upsell our medication. And in patients with diabetes or insurance coverage, medications may be prescribed directly through the patient's pharmacy benefit when appropriate. Now, our patients are not simply paying for access to a prescription. They are investing in a structured medical program focused on long-term metabolic health. And this is another important point people need to understand. The goal is not always to be on the highest dose on these GLP-1s. The goal is the lowest effective dose that supports steady, tolerable, medically appropriate progress while preserving nutritional health and lean body mass. So if a patient is losing weight too rapidly, not eating enough protein, losing muscle mass, becoming weak, dehydrated, chronically nauseated, or developing worse nutritional depletion, those are clinical signs that require reassessment. Weight loss care should involve ongoing monitoring and individualized adjustment, not automatic dose escalation every month without deeper evaluation. At Daily Elite Health and Wellness, we believe sustainable weight loss requires nutritional optimization, adequate protein intake, resistance training and movement, metabolic support, stress resilience, sleep optimization, education, and long-term behavior change. You're going to hear me repeat these things over and over again because these are core. These are critical. If you don't have these things in place in your medically managed weight loss program, the chances of you putting the weight back on and being more unhealthy once you stop the medications are huge. The medications may help create an opportunity for change, but the long-term outcome depends on what patients build underneath that opportunity. And ultimately, that is the difference between temporary weight loss and long-term metabolic healing. Thank you for joining me today, and I truly hope this conversation helped bring more clarity to what healthy, sustainable weight loss should actually look like. Our philosophy is very simple. Real health is not about starving the body, chasing rapid scale changes, or relying on medications alone. It is about understanding your body, correcting dysfunction, restoring nutritional health, improving metabolic resilience, preserving strength and muscle, and building sustainable habits that support long-term wellness. At Daily Elite Health and Wellness, we believe patients deserve education, transparency, comprehensive care, and medically managed approach that treats the whole person, not just the number on the scale. So if you feel the time is right to begin your journey toward becoming a healthier, stronger, and more informed version of yourself, we would love to help guide and support you along the way. You can contact us at 971-915-2531 or hop onto our website at dailyelitehealth-wellness.com. Learn more about all of the other services that we provide. You can schedule appointments on there. You can send us a message on there. Remember, true healing starts at the root. So come in, reboot your root with us at Daily Elite Health and Wellness. I'm Nurse Practitioner Kelly, and I'll see you next time.